Nice to see so many people logging on. We're very much looking forward to the presentation today. Just wanted to say a quick introduction to the person that I'm very fortunate to report to in my position in the Office for the Vice President for Health Sciences. Before I do that, though, really quickly, the presentations are packed today. You guys have probably seen the schedule. We have approximately 30 presenters. They've done a great job of packaging things up for you in a succinct way. We are recording, so all of this will be available on our Health Sciences YouTube channel. For anybody that wants to refer their team or wants to go back to something, it will be there as long as with their slide decks. So thanks to the presenters, but more so, I wanted to just basically introduce Dr. Bashir. She's got some welcoming remarks for you, but I'm super excited. Dr. Bashir, for many of you, recognize she's been here for about 3 years now. I think the one thing that she imparts on our office from a mission and vision standpoint is that we always have in the back of our minds, what can we do to make life easier for all of you in the research space? In fact, she says easy button regularly, and she has one in her office that I probably have to send a video of at some point because it's very funny. Many of you see her in a leadership capacity with all that she does to not only lead the Jacobs School, but also the Health Sciences Coordination. But she is a very accomplished researcher herself. If you do not know that much about her, have not read her bio. She's been funded by NIH for approximately 30 years continuously. And I can tell you, and the last thing that I'll share is that I know personally that some of her scores are things that people only dream of when they put their proposals together. So she knows her stuff in this space, and we're fortunate to have her. So Dr. Bashir, thanks for taking the time to kick us off this morning.
Oh my gosh, Dr. Ciegos, thank you so much for that lovely introduction, and thank you to everyone for being here. Really, we are so excited to see all of the colleagues, future collaborators, friends, everyone who's been so involved in the research mission. So as Jill said, this is part of the Vice President for Health Sciences Research Orientation. And one of the things we want to do is set everyone up for success. And as Jill mentioned, we really want to make that the easy button. And one of those ways is to make sure that everyone knows all of the wonderful resources that are available here at the University at Buffalo. So this annual event, Dr. Cizek launched in 2024, and it was a resounding success. And now we are doing that again, and we're trying to make sure that you know that we are here to set you up for success, and all of the people who are presenting here are part of that success. So you're going to hear from representatives from sponsored programs, the IRB, the core facilities on all 3 campuses, the Clinical Research Office, the Community Health Equity Research Institute with their new leader, Dr. Gardner. We're so pleased to have her here. UB, in case you haven't heard, there's something out there called AI, and UB is at the forefront of AI. You're going to hear from the Institute of Artificial Intelligence and Data Science. Hopefully they'll also mention a bit about Empire AI. We're so proud to have UB be the home of Empire AI. We also have the Center for Computational Research and the Hoffman Woodward Medical Research Institute that is now part of UB. And then, of course, our partners down the street, the Roswell Comprehensive Cancer Center. So today, what we really want to talk about is how we are going to transform health of Western New York and the region and contribute to that work across the country. And so I really want to thank Dr. Cizek for her vision and her team. She designs programs, seminars, symposiums, and behind the scenes today, she's trying to get someone's PCORI submitted. So she really lives and breathes the research mission on a daily basis. So here we just want to make sure that we're listening to you. We understand what you need. If there's something that you aren't getting that you need, please let us know, because we think that UB has a great deal to offer our region as well as our country. We have cutting-edge research. We are the home of a newly awarded CTSA, now in its third cycle for 7 years. And again, we're the home of Empire AI. We have strengths across multiple modalities, but we have significant core strength, and we have resources here that can support you. There's been tremendous amount of investment in science here at UB, and we want to make sure that we're taking advantage of that. So thank you again. Thank you to Dr. Cizak and her team. We're going to go ahead and begin the research journey. And again, wonderful to meet everyone. Thank you for being here. And thank you for making the University at Buffalo your place to do research.
Thank you, Dr. Bashir, for taking the time to join us. So with that, our schedule today, and I can probably put that up at some point because I'm not sure how detailed we are on the website with some final adjustments that we had to make, but I'm actually your first presenter this morning. And what I'd like to do is just level set a little bit and give you a bit of background on what our office does to support all of the investigators, the ADRs, and the deans across all of the health sciences schools, specifically in the research space. So I am part of a team that exists in the Office for the Vice President for Health Sciences. The Vice President for Health Sciences office oversees a number of different units across the university, but our office in particular is really aimed at is what Dr. Bashir just mentioned, supporting investigators to pursue either unique funding opportunities or significant scale funding opportunities. And we do that in a bunch of different ways. And, today's a good example of it. What can we do to support all of you and your colleagues and your teams in your space to be most effective? We help investigators find collaborators. We build teams with people. We look for funding opportunities for people. Part of the team that I'm on, and I forgive me, coming back into today, it's with the PCORI due, we've been a little bit swamped, but my colleagues, we have Karen Ventrilla, who has tremendous expertise, was in the Office of Corporate Foundation and Relations for a period of years, and has also served in numerous capacities on campus and proposal preparation. Karen brings a wealth of experience in really the DoD type funding opportunities. So she understands DoD. She's actually spent most of her summer with some of you that I see on the call on CDMRP as a unique funding opportunity and putting proposals like that together. She also has taken the lead for our team in something called OTAs, Other Transaction Authority, which are funding opportunities through the Department of Defense that are quite unique. We apply to them through a consortium, and they can be significant scale. To give you an example, Dr. Bashir at one point was in leadership at Wake Forest down south. And Wake Forest, I think, has an OTA that they secured somewhere in the $80 million range. But they're unique funding opportunities. And quite frankly, once you actually find an affinity with one of their program officers, it's a contract basis. You usually retain that funding for a long period of time. And the success rates, once you actually get through the door, they're quite good. So Karen really brings a lot of talent and expertise to our team in that way. Also part of our team is Dr. Beth Dolph. Beth joined us again with years of experience at the university. She was integral to the Department of Surgery here at the university. And she really, not only at the university, but in her previous positions, is very adept at NIH funding mechanisms. And what does that mean from the vantage of our office? When I say large and complex proposals is generally what we support. For something like Beth would typically put her hands on, it's not the traditional R01. We know that you all have the support in your units in order to be able to accomplish submission of the more traditional mechanisms. But we have heard from investigators over a period of years that they would love to go after a T award. And we know that they're not significant in scale from a financial vantage, but they are extremely prestigious, and they serve a tremendous function for campus and training the next generation. So Dr. Dolph would work with investigators on T awards because at the departmental level, to prepare all the tables, to gather all the data, it can be rather onerous. And so she has excellent experience in that way. She has also taken the lead for us this summer, as Dr. Bashir mentioned, with the PCORI that we are submitting this afternoon. And PCORI is something that we want to be on everybody's radar. We think it's a wonderful fit for UB. We think it's a wonderful fit for Buffalo. And so she has really taken the lead for us in that regard as well. And a person that just joined our team that some of you, if you're in the basic research units, you may be familiar with, Dr. Amber Worrell. Joined our team. I actually think it's probably not even a month ago. She has joined us to help investigators specifically focus on their scientific editing and document compilation. So she has her PhD in pathology. She used to work with Wade Sigurdson and Dr. Tomaszewski in the microscopy course. So she has a basic science background, is extremely well-versed, and can provide services in that regard. So we have a group put together, and you've got me in the mix too, that I'm really good at just proofing tables and stuff. No, I'm joking, but we're definitely a team that wants to support you in many regards. I will, and you'll probably see it, we have a ton of programming scheduled for the fall semester. I think we have over 20 different offerings for just the fall alone. And so just watch for us for dates that will be coming out. Exciting opportunities. We have a panel with Kaleida Health and ECMC next week, and that's in regards to population health and the implementation of EPIC. We have Dr. Nora Volko, who's the NIH director for NIDA, who will be joining us next, I think it's next week. I have to look at the dates on my calendar. But it's a very unique opportunity to have an NIH director give a presentation just for our faculty and our teams, especially in the current climate. So we're very, very excited about that. And then another thing that I will mention, October 8th, we have a committee that's been working quite hard and taken very seriously, putting together 3 different keynotes and 3 panel presentations specifically on sandwich generation. And I know that many of you are probably familiar with the term, but if you're not, it's basically looking at the effects of caregiving when an individual or a family is feeling the effects of caregiving on both sides of the spectrum. So caring for parents, but at the same time also having, children either still at home or in the mix that you're caregiving for, or maybe even a close relative that is special needs. So it's a unique opportunity. We found that it's a topic that's quite common in some of the public literature, but not a lot of universities are focused on it right now. And with the talents across our health science schools and the full complement of health science schools, from public health to social work to pharmacy, it really does touch every single one of us. And so we're hoping to set a trend and highlight UB as a leader in this space. So this presentation will be posted, and I have to give thanks to my colleague Karen Ventrilla, who worked on this because of a presentation she was doing for the Department of Pediatrics. This is a good resource for you, especially if you're an early career person and you have so much information being thrown at you. But she's put together a table on the traditional NIH deadlines, and this will be posted on our website. PCORI deadlines, for those of you, you might hear a little bit about PCORI today. I know that some of you have worked with us on PCORIs, and we've enjoyed it very much. PCORI is a unique funding agency. They really look at comparative effectiveness research, and it's very, very close to patients, caregivers, clinicians. So if you have something, I think the best way that they explain it is that if you're facing a question in your discipline or in the space that you navigate, and it's a challenge for any of the constituents that I just mentioned as to, is this the better option or is this the better option? Perhaps it's a medication. Perhaps it's a caregiving strategy. It could be any of those things that are challenging the field and people in general. That's a really good fit for PCORI. On average, and I can share with you, the PCORI that we're submitting today is about $8 million direct and comes to 13 million total cost over a period of 5 years. So there's longevity in their awards, and they're of nice scale. And based on what we know of all of you and the talents that you bring to the university, it can really be a very good fit for what we have here at the university. So think about that. DOD, I already mentioned Karen Ventrilla and the many things that she brings to our team. This is actually also a good listing to go to that will be published on our website. Good to know. We have a new health sciences website that does a number of different things for you. It's the one-stop shop for all of the events that we have coming up. You'll see them all listed with dates, times, ways to link or to jump on or register. It also has a secure element for UB team members for common grant elements. So if you're looking for a statement on our most recent DEI efforts, or you want to know, and we're actually chasing this down right now, you want to put a statement or a paragraph into a submission on what Empire AI is doing specifically at the university. Or you just want the approved content for the Jacobs School language that we put out, or the CTSI, you will find it in that secure element of the site. It also directs you to the many offices that we actually offer support through. A good example is a team that we set up last year. It's under the leadership of Dr. Greg Wilding. He's a faculty member in the Department of Biostatistics, but he also leads BIRD for the CTSI. And he's directing this office called the Office of Clinical Translational Data Implementation. And what they are intended to do is that they can help you with the statistics for a proposal. They could help you with the data analysis for data that you have coming back as the result of a project. They can do that on an hourly basis. They can be part of your grant, but they are very much accessible and part of our efforts. So I would encourage you to look at that as something that's new part of our VPHS website. Lastly, you can contact us this way. It's the general VPHS email. Our offices were situated on the 6th floor of the Jacobs School. But generally speaking, my colleagues and I are extremely accessible. You'll see in my email signature, not only my office location and all of the credentials, but you'll see my cell phone number. So many a times, if something comes up and you're under a deadline, feel free to make a phone call or drop a text. So we encourage you to take a look at spending more time with us or reaching out to us should you have any challenges. And I'll just say lastly, we work very collaboratively with all of the units and the ADRs and the research support services across the health science schools. So we don't operate independently. We work very collaboratively with them. So with that, I'll just, again, one last time, thanks to each of you for joining us. I appreciate the fact that everybody muted themselves. We are moving quickly, so we won't be taking questions. But next up on the agenda, I have Chris DeLello, who is going to be presenting to us. I'm sorry, Chris, I ran a couple of minutes over, and he leads human resources for the university.